Hello, everybody. This is Jan Trnka, and I would like to talk to you briefly about the use of interprofessional education in preclinical settings. Now, what is IPE, interprofessional education? The most used definition is that it's learning with, from, and about other professions to improve collaboration and the quality of care. The idea being that in clinical practice, the different professions that are involved need to work together, need to be able to communicate, need to be able to exchange information about patients or other things. They need to be able to know what the roles of the different professions are, etc. Now, what kind of professions are involved in healthcare? There are quite a few, and probably more and more will be coming in. Of course, there are nurses, nutritional therapists, occupational therapists, physicians, physiotherapists, social workers, and others. And these need to work to be able to work together in different settings, in different situations. And that's why interprofessional education is needed at various times, maybe at all times of their professional development. Now, most IPE that people talk about and people hear about is done in clinical settings, whether pre-qualification or post-qualification education. And the reason for that is probably quite clear, because in clinical settings and using clinical problems, the interaction of an interprofessional team is probably the closest to what it actually is in clinical practice. However, we may argue that introducing into professional education early on in the professional development might be advantageous. And what could be the reasons for including interprofessional learning sessions in preclinical settings? Well, first of all, is to introduce the different healthcare professions very early on, because it's quite likely that many of the students, either of medicine or any other of the any other of the professional development programs, may not be aware in the beginning what different professions are involved in healthcare, what their roles are, who they are, what they're actually studying, etc. So introducing the different healthcare professions that all the students will meet later on in the beginning of the program might be a good idea. An early IPE program or course may help forge personal contacts between the different professions that can actually last throughout the different educational programs, and may actually mediate or make possible continuing informal meetings between the different professions, and therefore informal education, informal interprofessional education. Now, IPE early on may allow students of those different professions to see similarities and differences in perspectives and approaches, which obviously makes it then easier for them to know what to expect from the different professions and how the different professions can use their different perspectives, approaches, and knowledge in a collaborative setting. And finally, and maybe the most important skill in the beginning of professional development, is developing collaboration skills that can be used later on in various situations and circumstances. Now, what can be done to implement interprofessional education in preclinical setting? Well, first of all, what form is best to be used? Now, it's probably quite clear that using a lecture on interprofessional education might be a good idea in some circumstances. So we can, for example, teach about what the different professions do, but that would be just a very small part of it, because of course, as we know from the definition, the different professions need to learn not only together with, but also from, and not only about, but they need to learn about other professions, but they need to learn together. So the best form possibly are collaborative small group sessions with experienced facilitators that can help with the collaborative part and some of the other parts of the session. Now, a big question is whether it's enough to have one-off interprofessional session where the different professions or the students of the different professions meet for one brief 1 hour, 2 hour session, they find out about each other and then they go their separate ways, or whether it's better to have a continuing longer course where the students actually have the opportunity to get to know each other quite well, to understand the different approaches and different perspectives, and also to work on their collaboration skills, because that is also something that may not be easily done in a short session. Now, of course, whether it's going to be a one-off or continuing course is also a question of logistics. And as we all know, fitting things into curricula of many of the healthcare professions is very difficult. So this is also a matter of practical importance. What kind of topics can we use in these sessions? Now, it will be especially, I mean, we're talking about preclinical settings, so we can't really use very advanced clinical cases because we are early on in the professional development. And it's very likely that the actual real-life clinical cases might not be useful because a lot of the students might not actually know enough to engage with them and to work as a team solving them. However, there are many topics that can be used in these sessions and actually can allow all the students, no matter how advanced they are and no matter what their program is, to be involved. And these include medical or general ethics, public health, and or social aspects of medicine. So any kind of relationship between medicine, healthcare, and society as a whole, where one doesn't really need any expert knowledge, but they can weigh in and see other people's perspectives and contribute their own perspectives. And finally, we could potentially develop sessions in health sciences where the different professions can take part. Now, it's probably not going to be a pure session on biochemistry or microbiology or something like that. But a colleague of mine actually mentioned a type of session that she started with medical students and nurses, where there was a combination of clinical practical skills, for example, giving injections, where the nurses were the ones who led that part of the session. So they were contributing skills that they were better in than the medical students, while the medical students contributed with potentially a deeper knowledge of physiology and anatomy that related to this procedure, such as injections. So one way of dealing with preclinical, with interprofessional education in health sciences could be a combination of knowledge and skills, with the different professions contributing different aspects of them. And of course, if we want to teach, if we want to educate, it's a good idea to assess whether the education provided actually made any difference. And one way of assessing interprofessional education, especially in preclinical settings, would be using a guided reflection where we could specifically look at changes in attitudes, values, improved communication skills, and collaborative skills in the students after the session. So that's one way of assessing it. So this was a very brief introduction or just a suggestion of how IPE can be used in preclinical settings. And the most important thing is just give interprofessional education a go. It's definitely worth it. Thank you for your attention.